Hey there, how's it going? A lot of people that I've seen have had a previous hip surgery and it never got better. Or they got better for a short period, but then they reverted back to having that significant hip pain.
Fellowship-trained and board-certified orthopedic surgeon Dr. Brandon Johnson and the team at Community Hospital now offer hope for those who suffer from nagging, chronic hip pain.
It was frustrating for me having this population of patients that they weren't doing well, they were healthy, they were young, they didn't need their hip replaced, but what they needed was a new labrum, essentially.
Labral reconstruction is a high-tech, minimally invasive surgery for patients who have no other options for relief.
Labral reconstruction is a procedure that is for individuals that have had chronic hip issues, they have severe tearing of the labrum in their hip, or they've had previous surgery where the labrum has been essentially removed or debrided.
Dr. Johnson is one of only a handful of surgeons around the world who offer this state-of-the-art technique. Community Hospital North is the Metro's newest hospital and now offers labral construction, an alternative to full hip replacement that offers excellent long-term pain relief.
My hope for this procedure is people in this region, whether it be Oklahoma, Texas, Arkansas, Kansas, can be able to come to a closer area rather than having to go to Colorado to have this procedure done. I'm excited about this procedure. I'm really excited about being able to offer this to my patients that seemingly had no other options.
These are the quads.
Ivy Lawson thought she had no other options. Only 22 years old, she's lived with pain every single day for the past several years. The result of a rowing injury.
I definitely felt like a 75-year-old sometimes. It wouldn't work right. The hip I couldn't lift it, couldn't move it. It was very painful, popped a lot. So at 22 years old, that's not how you want to be feeling.
Already having endured one surgery that didn't fix the problem, Ivy turned to Dr. Johnson, desperate for relief.
I work as a PT tech, and I had seen a lot of really great results from patients that he had done surgery on that were in our clinic doing some recovery. And they all spoke very highly of him. I heard nothing but great things. And so after hearing all of those positive comments, I decided to just let him work his magic, so to speak.
And now she walks without a limp. Only 10 weeks post-op, Ivy is ready for a run. A remarkable change for a young woman who could barely walk just 3 months ago. Now jogging around town.
It felt awesome. There was no pain whatsoever. The hip moved great. Honestly, I wanted to keep going. It took a lot of self-control to stop and not just keep running down the street because it felt so good. And I was like, I never thought that I could run or feel like that running again. I don't think I could tell him thank you enough. I think if I called him on the phone every day and said thank you, it still wouldn't be enough because I really feel like I have almost a second chance at life.